good morning, everyone. Welcome to today's COVID-19 virtual open sharing call. I'm Nancy Miller with Stratus Health, which is a partner in the Superior Health Quality Alliance. The purpose of today's call is to provide a venue for networking and sharing about COVID-19 across settings of healthcare. And before we get started, I want to, on behalf of Superior Health Quality Alliance, thank all of you for all that you do every day to support the health and of those in your community and for the improvement of healthcare. This just shows some upcoming events. Today, 4 to 5 Eastern, 3 to 4 Central Time, there will be a call on PPE strategies for COVID care, and a link will be listed in the chat. Just as a reminder, next week is kind of a holiday week, so there will not be a call next Thursday. So we'll have one the following week. We will put an evaluation in the chats to let us know how we're doing. We appreciate if you just take a moment to do that sometime. And if there is enough time at the end of the day today, at the end of the more formal session, we will open it up to the state-specific calls. For those of you, many of you have already participated in that, but for those of you who haven't, we'll break up into a Minnesota only, a Wisconsin only, and a Michigan only, and we'll walk you through that if we have time. Just as a quick reminder of who we are as Superior Health Quality Alliance, this is an organization of eight healthcare organizations which formed in 2018 across 6 states, and it includes those you may know very well: Stratus Health in Minnesota, MPRO in Michigan, and Metastar in Wisconsin. And we're working collaboratively across broad to achieve broad goals for CMS quality strategies, and you may get some more of that information from your local QIO. And our goal is to collaboratively improve the quality of health and healthcare across all settings in the communities we serve. Just as a reminder that all of these sessions are recorded, so if you or your colleagues want to go back and review the information, or if you weren't able to attend, you can look at it at a future date. Please do mute yourself when you're not speaking. We encourage participation, so please do put your questions or comments in chat, or if you want to speak, then unmute yourself. If you're on the phone, just press #6 or *6 to unmute. And again, we remind you not to disclose PHI. If you have any problems with Zoom, please message Elena Smith into the chat box and she'll help you out. If you have any other questions or comments, please share them with everybody so that we can address them across the board. And if we can't answer your questions on the call, we'll try to get back to you. Here is just some resources that you can use from CDC, CMS, and SNF admission specifications. If you have a topic, a resource, or process you want to share in the future, please do let us know. You can send it to your QIO representative in the state, Barb Link in Michigan, Janelle Shear in Minnesota, and Jill Hansen in Wisconsin, or just share it in the chat and we'll get back to you. We encourage broad participation across the region. All of these calls have been very informative, and we want to keep providing this resource to you going forward. And without further ado, I will introduce our featured presentation today, and they're going to be addressing COVID-19 in rural communities. And we're very pleased to have with us today Kathy Miller, who's the Director of Quality and Safety, and Diane Kuglin, a Manager of Case Management at Essentia Health St. Joseph Medical Center in Brainerd, Minnesota. So without further ado, you can take it away. Here's the polling results, by the way. So it looks like a few more in rural Minnesota, rural communities, 60, 55, 45, close enough. And Elena, were those results shared?
I did really briefly. So it was 55% answered yes, and 45% answered that they do not work in rural communities.
Great. Thanks so much. And we'll turn it over then to Kathy and Diane.
Thank you. Good morning. This is Kathy Miller, and I thank you for allowing us this opportunity to present to you today. My partner, Diane Kuglin, and myself work closely together, and we will tag team this presentation. I'm going to give you a little bit of the background about how we started on this journey real quickly, so you are aware of what kinds of things transpired. So we are part of a larger organization. Essentia Health is actually in 4 different states: Wisconsin, Minnesota, North Dakota, and Idaho. And we are the central market. Brainerd is about 2 hours north of the Twin Cities, just to orient you. Our main headquarters is in Duluth, Minnesota. And we found that in early May, one of their nursing homes in Duluth had an outbreak of COVID-19. And one of the issues that they had is that there were staff such as dietary people and housekeepers that were very fearful of catching the disease and actually walked out and left them kind of high and dry. And so they reached out to our sister hospitals in Duluth, asking if they could help them with their staffing needs. So we were already, each of our individual areas, including Brainerd, were looking on developing a guidance document where we would work closely with our partners in the community, long-term care, assisted living, and our SNFs, in order to come up with the responses. What are we going to do if we do see a huge outbreak in one of those facilities? We had already, like all hospitals across the country, been working on what our internal plan would be. While we were in the midst of working on this document with our partners, lo and behold, we hadn't even finished it, and we were contacted by one of our local skilled nursing facilities, a Good Samaritan facility, which is owned by Sanford Health, on Thursday, May 14th, that they had a positive resident. The following day, they reached out for help. And we quickly convened a team on Saturday morning with not only representatives from the Good Sam Nursing Home, but also our chief medical officer and several other people to develop a plan for what we could do to support them. They had reached out to their parent company, and they were hoping that they would be able to provide them support, because what they were finding was happening is they were starting to have more and more patients that were testing positive. We worked with our lab, and we actually went to their facility and helped them start rapid testing so that we could get those results back right away. So by that Monday, which is just a couple of days later, they had already had 21 positive people in their facility. 13 of those were residents, but 8 were staff, and all of those staff were asymptomatic, which is what became worrisome for us. So we decided that as we worked closely with them, that we were going to need to test everybody in the facility. And that was between patients and staff, that was about 200 individuals. So we had to make sure that we had the proper supplies. By that Thursday, so we're talking just barely a week later, they were already getting desperate for staff because they had so many people that they had to take off work and put into quarantine. They were unable to secure any additional staffing from their parent company who thought they might be able to help them. So we quickly put out an email and a text to our staff asking if anyone would be willing to volunteer to work at the skilled nursing facility. And we actually had 11 people that responded. So we quickly put together a contract so that we would be able to have those nurses and those nursing assistants work there. And that was all put through by Friday. By Saturday, they were able to reach out to the Mid-Minnesota Coalition, which is our local public health that we worked with through the Minnesota Department of Health. And they were actually able to send them 2 nurses to get them through over the weekend. So we did not actually send them staff. By the following week, Sanford was able to relocate 2 of their nurses who worked in a pool across the United States, who are presently working in Colorado, that was able to come to Brainerd, Minnesota to get them by. As time went on, we continued to test those patients for them. They also had several patients that were admitted to our intensive care unit. The majority of those patients were able to return back. They did have a total of 10 deaths altogether, which was very unfortunate. They are now at this point in time seeing a decrease in the number of positive patients. They had already been working on a separate wing of the building where they were able to isolate those COVID positive patients. And so that was very helpful because we were worried about what was going to happen with discharges, if they were going to be able to be discharged back into the community. At one point in time, they contacted us to see if they could admit their COVID positive patients to the hospital when they were very short of staff. And we knew that that wasn't going to be an option. So that was another reason why we worked with trying to support them from staffing needs. And we were very grateful to those nurses and those nursing assistants who did volunteer to reach out and help them. So as we continued on working very closely together, we have been meeting on a weekly basis with all of our community partners. And my colleague, Diane Kuglin, has been instrumental in bringing those people together, working with our local county health departments. And she is going to tell you a little bit about some of the specifics that we have done within those meeting structures and how we have continued to work together. So I am going to hand it over to my colleague, Diane Kuglin. Nancy, as you know, I will be able to stay on this call until 9:30. If there are any questions that anyone has that I can answer, I am happy to do that. So thank you so very much.
Thank you, Kathy. My name is Diane Kuglin. As she mentioned, I'm the manager of case management working with discharge planning here at our hospital. And the areas that I want to touch on in regard to this COVID outbreak in our community are, like Kathy mentioned, the collaborative that we established and what that looked like for our community, as well as some takeaways that our facility with the outbreak gave back to me. I really feel it's their story to tell, and we had hoped that they'd be able to join us today, but because they're still really in kind of the mix of, they are on the downside of the outbreak, but still struggling with staffing and other things. And so she did share with me a really nice write-up of some takeaways and learnings and things that that I want to share with you after I talk about our collaborative. So as Kathy mentioned, prior to the outbreak in our community, we had started to establish a COVID Community Partners Collaborative is what we called it, for lack of a better term. Basically a meeting that was chaired by our hospital and held weekly with our community partners. So our nursing homes, our assisted livings, home cares, all invited to participate. And we were really thankful to Janelle and her team, who really worked hard to reach out and gather emails and contacts at all of these facilities to to invite them to participate, with our goal of the meeting really being to have an opportunity for collaboration, for communication, to talk through a lot of the things that were coming up, because we knew it wasn't just isolated at one place that would have questions and concerns about testing and processes, but we would all be facing similar questions. And so really just opening up a forum for us to have that conversation. And also from the hospital perspective, really wanting to have communication, have partnerships, which of course we've worked on through the years, but further discussions to establish that so that we wouldn't have a backup of patients in the hospital were we to have a patient surge. We really wanted to assure that we had some communication and strategies in place so that we could have effective, timely discharges from the hospital. So when we had a surge of patients that needed acute care, that we would have that availability. So we had started this community collaborative, and we really did have a good response to the meetings. Some of them, I think we had over 35 to 38, somewhere in there, different facilities participating, which is a lot in a community our size. And like Kathy mentioned, initially we were meeting weekly all through the month of May and into June. And then really what we decided after that was to kind of take it down to every other week. So like I said, our goal was to facilitate that communication, to share resources. There were a lot of different resources that were coming out from different places, making sure everybody had those available to them, really talking through our testing strategies from our perspective. Initially, as we started in this COVID journey, as you know, the availability of testing was kind of an issue, and the timeline for testing, and congregate sites had concerns about, were we testing everybody when they came in? Were we testing people prior to their return to those congregate sites? So we worked out a workflow, an algorithm that we were able to then share with all the facilities at one time and say, here's what we're able to do based on the availability of testing, based on CDC and Minnesota Department of Health guidelines. And so I think that was a good opportunity to share that communication with all the different agencies, as well as give them the opportunity to voice concerns and questions for our colleagues. We did, from an Essentia Health Hospital perspective, have our infectious disease specialists, our infection control colleagues, quality, our hospitalist on the team, lab, to really be able to have those folks available should the facilities have questions. And they did, so that really worked out well. Let's see. The other thing that we did on our collaborative calls was to talk about and kind of put into one place the availability of different facilities to take admissions, and the availability of facilities and agencies to take COVID positive patients. Really trying to establish a database in conjunction with our county colleagues of who could we look to for those different things when we needed them. And so we kept a spreadsheet that we shared with all the people on the call, as well as with our county colleagues from public health, to be able to have that continuity there, that availability of information. Transportation was another big thing that we knew we would run into issues and concerns with. And so weekly we would talk about which facilities would be able to transport their patients, who could transport COVID positive patients, which continues to be a struggle. And I imagine that's probably a struggle across other smaller communities as well. But just having that opportunity to talk about that was helpful. In addition to having the collaborative, the other thing that Kathy alluded to a bit was that we did establish a document within Essentia Health with our other colleagues at, again, at the county. And what it is we established a guidance on long-term care, assisted living, skilled nursing facility response and containment. So really calling out for each, if there is an outbreak in a facility, what does the health system, what's their responsibility is going to be? What is the agency or facility with the outbreak? What is their responsibility going to be? And really putting in there some quick links for them to the information that they need. What would be the responsibility for the response from the county public health team and also from the Department of Health, and just putting it into a 2-page document that we did distribute to all of the agencies and facilities that were participating on our call. And I think that was well received, and it took a bit of time to put it together, but I think in the long run, it was really a good time savings for people to have that information at the ready when they need it. We did put together an email for facility to share with facilities that would go to our crisis team, so to speak, within Essentia Health. So if an agency had an outbreak, they could email and can email that one email, and it would go to everybody at Essentia Health that is on the response team for an outbreak. So since we've only had the one outbreak so far, we haven't, and the email address was actually established after the Good Sam outbreak. We haven't had that utilized yet, but it's there should another occasion arise within our community where somebody would have an outbreak and need to reach out to us. So we assisted, as Kathy said, with test kits, with testing, with this offering for staff. And really, I think it was a good partnership, well received, and really gave us a lot of respect for them for us and us for them, and really solidified that partnership within the community. And so I think that was a good thing. So as I mentioned earlier, I did reach out to the director of nursing and asked her for some takeaways. And so if it's okay, I'm going to read some of this. Since it's her words, I don't want to really, I'm going to summarize it a bit, but mostly want it to be her words. So this is from their director of nursing services. We are extremely happy so I asked her, what were some things you were glad you did ahead of time, as well as what are some things that you learned and appreciated? So she said they were really happy that they had made an isolation unit and secured it off before they had an outbreak and before Minnesota really had any COVID cases in a large quantity. They also were happy that they had used something that their agency put out, which is called Facts Over Fear. And it was just a daily brief that they could give to their staff that said, here's the facts, to kind of bring down that fear level among their staff. And they said they kept it up, posted it daily with new information that came out for their staff to read. And she thought that was extremely helpful. They were happy that they had closed their doors to visitors prior to it being mandated. They were also happy that they had used cloth masks before they were told to. So really proactively working on some of these things that I think most likely all sites are now doing, but because they were on the early side of things. They were glad that they had dropped their temperature threshold on staff screening to 99 and above from 100.4, which is what they had initially done. She said, we caught many positive staff and sent them to be tested, helping to prevent the transmission into the facility. We were extremely grateful. Essentia partnered with us in the way they did, and we were able to identify, isolate, and protect very quickly. They were also extremely fortunate. She said that their medical director took an amazingly active role and became the primary care provider for all the COVID unit patients during this outbreak, and doing virtual rounding daily on those patients in that COVID unit. She said without that, they feel that they would have had more patients that passed away from this COVID outbreak. She said, for us, the key was preparing and education. Knowledge is power. And she really felt that they learned a lot and that preparing was very important. We learned that staff that stuck with us through it were the kind of people that we want working with us. We became a strong family as we went through this horrible time together, cried together, prayed together, and are now laughing and healing together. We did lose a few staff to fear, and there's nothing wrong with fear, but when there is no trust, there is poor performance, and they are not vested in the process of improving, they are part of the problem. While this may have cut us deeply in the moment, it has made us stronger in the long run with a stronger team who truly have each other's back. So really walking through that difficult situation together. And I remember one of the calls that we had as they were in the midst of it, and she just really said it was kind of like this invisible enemy that you're trying to fight, this COVID infection, but it was difficult as they were walking through it. We learned that even though you think you have enough staff to carry you through your outbreak, you don't. have backups prepared to come in at a minute's notice. And I think that was really, don't you think, Kathy, one of the biggest struggles, that once you have patients positive and you start testing every staff member, it's, so many patients or so many staff members that you have to send home to isolate. And it really cuts into your staffing when you're, not a huge facility with a lot of backup.
You're right, Diane, because she did say that they had several nurses that were so exhausted because they had worked 6 days in a row, and some of them had worked 16 and 18 hours because there was no one else to care for those patients. So they truly were desperate when they said they were desperate for help.
Mm-hmm. She said, we learned that even though our regional team worked from home, they supported us every day. We had daily regional calls to share stories and successes so we could all learn from each other. We had 2 infection control surveys. So survey teams were sent out to their facility. The first time we were nervous as we didn't know what to expect, and the surveys offered a few suggestions but had no issues with anything we had put in place. The second survey came as a number of positives continued to grow and the first deaths occurred. They watched staff don and doff PPE, provide care in the long-term care side, and then went into our COVID unit. They came out amazed, and their comment was, we came here to help and see how we could educate your staff, but you've actually given us an education. So really having staff aware of the process of the PPE and the transmission of the virus. When we started this outbreak, we were told the trend is about 1/3 of all residents diagnosed will die. We were shocked and saddened, but we did hit the 1/3 mark. We have 32 residents who are positive and 10 have died so far. So it's a very difficult thing to walk through as a facility, and that's really sobering when you think about 1/3 of their patients that had it did pass away from it already. But I feel that really honored to have been able to partner with them, and in any small way be able to offer some support, encouragement, and backup for them that we were able to do. But really, it's their journey, and I'm sure down the road sometime Jean might be able to share more personally kind of some of the things that they walked through, but being able to represent them, I feel honored to do that. So that is what I have, and I don't know if anybody has any other questions, or if Kathy, if you have any other input to add.
I do not. I'm just wondering if there's any questions as well.
There is a comment in the chat from SML Trinity Health, I'm not sure where that is, who said, we also established daily calls with our post-acute providers, but had some issues with the acceptance of COVID plus patients. Some facilities only wanted to accept their own positive returns, but no new patients. And she asked, was this site, were you able to assist SNFs with PPE? Also, did you have any issues with dialysis patients?
So we didn't have issues with dialysis that came up. We don't have a dialysis unit in our hospital. And as far as PPE, I don't think that we assisted with PPE. To my knowledge, they were able to get the amount of PPE that they needed from their, through the state and through their corporate office. And yes, we do continue to run into difficulties with placement of COVID positive patients in post-acute care settings. Most of them are naive at this point, and so they are not accepting new admissions that are COVID positive, really wanting to keep it out of their facility for their current residents. And so we have struggled with that. We haven't had a large number of COVID positive patients that we have had to look for post-acute care placement for. Most all sites on our post-acute care call have indicated that if it was their own patient that was positive, that they would take them back, and that was true of Good Sam. They did take theirs back, and most of our post-acute partners have indicated that they have a plan, that they do either have a unit or a process put in place where they're going to take their own patients back once that's necessary. And transportation, like I said earlier, has continued to be a problem as far as finding transportation providers that will transport COVID positive patients. So I hope that answers the question. But
a question from Lisa Gall. What are you doing for home care discharge?
We do have home care agencies that are accepting COVID positive patients. And so we have been able to make referrals to some of those agencies. As an agency ourselves, we are working on, and I think it's to roll out pretty quickly, in-home monitoring for COVID positive patients through Essentia Health, where they can do virtual calls and visits in their home with monitoring equipment, checking their vitals and other information from home in order to be able to isolate them that way and be able to care for them. But I don't think it's quite rolled out yet, but soon.
This is Jerry Henniker from Superior Health also. I just want to tag on to that home care question. I know of one agency up here in the Twin Cities area in Minnesota that is actually partnering with home care as kind of a backup for their assisted living and nursing homes. So if the home care staff isn't busy, they're actually then coming in and helping in the assisted living or the nursing home. Just wondering if that's something that you have considered, or actually if even anybody else on the call today is maybe doing, and how that's working.
I'm not aware of any partnerships similar to that at this point. I do know our home care agencies have been extremely busy, in large part because the fact that a lot of patients and families are really not interested in their parent or family member going to a congregate site right now with this outbreak. And so we have had a huge increase in home care referrals, not necessarily for COVID positive patients, but just patients in general that maybe in the past without this pandemic would have gone to a site for some rehab or some respite or long-term care even. And right now they're saying, we're not interested, we want to wait. And so we've had a real uptick in home care referrals to the point with it being a rural community. And we do have several great agencies in our community, but we've had we can take them, but we can't start till next week, not till the end of next week, that kind of thing. So I don't know that the home care agencies in our community right now have the opportunity with staffing to go to that level, but maybe someone else on the call has had that partnership that they could talk about.
Hi, Diane and Kathy. This is Janelle Shear from Superior Health. And I just want to say I've had the privilege of joining in on some of these calls with the post-acute partners. And just some comments from my observations are that you've had a variety of people, and the transparency that your post-acute partners have had has been impressive. So when Good Samaritan had their case, they were just open and honest. They talked about their lessons learned. And then from the health system side, I just saw such empathy and understanding and compassion that it felt to me like you had a truly awesome working relationship. And when folks would say, we aren't taking any COVID patients, there was no judgment on your part. So I just really want to commend you for your relationship and the work you've done in planning and being prepared for, the surge or whatever was going to happen in the community. So thanks so much for your presentation today.
Thank you. Thank you for asking us. It was a real honor to participate. And if anybody comes up with any questions after the fact that they think of, that we can share something that we learned or experienced, happy to do that. So they could probably go through you.
There is another question in the chat. Again, how are your facilities handling the new order about testing residents and staff every 14 days?
We don't have any skilled nursing facilities that are Essentia Health facilities, so I don't know all of their testing strategies. I do know that there have been a couple agencies that have reached out to us to partner with them for doing the point prevalence testing. And depending on our capacity, I think we have worked with a couple facilities and able to accomplish that with them. And I think the tests themselves were sent out since it wasn't of an urgent time frame. I believe that they were channeled through our health organization through to the Mayo testing lab. The initial ones, they were looking for rapid results, and so a lot of those were done either on the rapid tests in-house or sent out to our sister organization in Duluth that had about, at that point, I think about a 24-hour turnaround, maybe 48-hour.
And at this point, I don't see any other questions in the chat. I'd like to open it up to the audience and see if there's anybody on either on the phone or on the Zoom call that have any questions. You can just unmute yourself. I don't see any, but again, if you have any, please don't hesitate to contact us and we will get the questions to Diane and Kathy and make that connection. On behalf of the Superior Health Quality Alliance, we thank you, Diane and Kathy, who had to leave, for your presentation. I guess I speak for all of us in saying that just it's just an amazing collaboration that you demonstrated in a very short period of time. Working with the counties was, I'm sure, really helpful as well. And we really appreciate your sharing the lessons learned from your nursing staff. That was great, great information. I'm interested in the brochure, The Facts Over Fear. Is that something that you put together yourselves or you disseminated? Is that something that you'd be willing to share?
So that was actually something that the Good Sam Sanford staff compiled and put together for their staff. So it may be something that they'd be able to share. That would be something that we would want to take to Jean, the nursing director.
Sure. Well, we'll follow up on that because
Sounds good.
That sounds like a really great resource.
Agreed.
With that, again, thanks
Thank
so
you.
much to you, Diane, and to Kathy. And I'm going to now turn it over to Elena, who will walk us through the process of moving into our state-specific discussions.